The Speaker of Gombe State House of Assembly, Honorable Abubakar Luggerewo, says efforts are on to achieve universal health coverage in the northeast state. The speaker gave the indication at a two-day workshop organized in Abuja by the Legislative Initiative for Sustainable Development and partners. He said the health insurance scheme bill passed by the Gombe State Assembly will create the provision for an equity fund of 1% of the state's consolidated revenue fund for the less privileged. He added that the gesture is expected to complement the efforts of the state government to achieve universal health coverage, as well becoming a leading Nigerian state with prosperous and healthy citizens.
The Governor, His Excellency has initiated an executive bill and sent it to us. We go through it in details. We compare it with those states that are performing very well in the nation. We come out with a very good legislature that will enable our health insurance scheme to be among the best one, not only in Nigeria, but in the world at large.
The speaker further expressed gratitude for the program, saying it will impact positively on the state health systems.
Previously, we don't have hospital management boards, but during this assembly, it has come to us and we pass it into law, and now the Gombe State Hospital Management Board is on, and they are up and doing in terms of enhancing the health center in our state.
On his part, the World Health Organization representative, Francis Ugwije, said the WHO was leading support to the legislative network for universal health coverage in Nigeria and other African countries.
What we are doing in the World Health Organization is lending our technical support, but not just lending our technical support, but extending this learning and best practice that we have in Nigeria to other African countries.
On her part, the Executive Director, Legislative Initiative and Sustainable Development, Mrs. Juliana Abode Arebo, said the objective of the capacity building was to deepen understanding of the legislature on health financing, universal health coverage and primary health care objectives and policies.
We are trying to see if beyond the statutory functions of the legislatures and of course the clerks and the health committee secretaries, how we can work with executives, CSOs and the media to say within the ambit of the bureaucracies that we work with and expectations, what else we can do as a legislature to ensure that even when the budgets are approved and the laws are enacted and funds appropriated, that it is backed by cash.
The theme of the two-day capacity building initiative is enhancing silence and capacity of Gombe State House of Assembly to catalyze Gombe's progress towards universal health coverage. Ugochi Obaja, CNN News.